Shafaq, it's lovely to speak with you today. Thank you very much for joining me. If you don't mind, can we please start with you maybe introducing yourself and telling us how you first got into dentistry?
Hi, so my name is Shafaq. I come from a very medical and dental family, so coming into dentistry seemed like a natural thing for me. I was never going to be an office-based worker. I knew that wasn't going to be something I could do. I was very much a people person, and I worked with my hands a lot. I did a lot of art, so it made sense for me to sort of naturally go into dentistry. I wanted to be in the healthcare profession. So I became a dental student in 1997, and that was it, at King's College, and that was it. That's how I got into dentistry.
And so tell me about when you first got your diagnosis. What were your first kind of thoughts, and how did you think it would impact your life?
I first got my diagnosis in July 2019, so I'd been a dentist for a long while by then, it was very shocking. No one in my family had actually had Parkinson's, and I certainly wasn't aware that people could get it as young as like 39, 40, which is how old I was when I first got the diagnosis. It was really destabilising, and I thought, of all things to get as a dentist, how am I gonna carry on dentistry? How am I gonna be able to, carry on practicing? And obviously, you worry about income and all sorts of things. It was very shocking, very destabilising initially, and it took I got my diagnosis in July 2019, and COVID happened, towards the latter end of the year and in early 2020s, and my neurologist at that point said to me that it's probably better, with all this COVID stuff going on, not knowing how it reacts with Parkinson's, that you have a bit of time out. So I think having that little bit of time out really helped me digest everything, and I started taking medication, got into a good exercise routine, and I realised that actually there's nothing different between me now and what there was before the diagnosis. Only now I know why I have a bit of a tremor sometimes, or why I feel a bit more anxious than I used to sometimes. So I guess once I got my mind around it, it was fine, and I just carried on. But the initial diagnosis was honestly, it took the rug out from beneath my feet completely.
What sort of support did you have at that time that kind of helped you get through it?
I did a lot of kung fu. I still do kung fu, which is brilliant. It's a really family-friendly group that I go to on a Tuesday evenings. It's run by another dentist actually, and it's just really friendly, really nice. It's not like really they're not super competitive with each other, so it's just go do what you can, and they have a good session of like cardio at the beginning, and then they do the kung fu stuff. I also love swimming, but I couldn't do that much during lockdown, and obviously the ultimate lockdown activity, walking. So got a lot of walks in, and it was beautiful weather that year despite everything else that was going on, so spent a lot of time outdoors as well. Now I do something called Nordic walking as well, which is very good. It's like walking using these poles, and I do that every Thursday as well, so that's very good for Parkinson's and other neurological conditions, so I do that too.
And so how does it affect your day-to-day life now?
My day-to-day life now obviously is affected in a few ways. It depends. It does sometimes affect my sleep. It can give you quite vivid and funny dreams. Sometimes my quality of sleep is affected, and that can affect how I work on a daily basis. So I have had to reduce my working hours, just to accommodate a few things. One, the exercise, which is essential to slowing down progression of Parkinson's, and two, to allow me to recover from any nights where I do have vivid dreams or insomnia, which is a really common event with people with Parkinson's. So that's how it affects me with regards to sleep. But then there's also medication. I have to remember to take this medication. I'm the sort of girl who never even popped a Nurofen or paracetamol much. So suddenly having to remember to take these levodopa tablets every day, and at a certain time, they like you to take them regularly so your body gets used to it. That's been quite difficult to get used to. But then my body reminds me when I haven't taken it, because the main symptom I have is an achy right shoulder, and if I haven't taken my medication, that comes on again quite prominently. So my body reminds me to take it. And then there's the changes I've had to make to daily life as well, like incorporating the extra exercise, like learning to take it a bit easier. I'm a kind of a full pelt person, and I've had to learn to take things a bit easier, and I'm moving sideways. So I love dentistry, absolutely. It's really quite sad maybe how much I love my job, but I do actually really enjoy working in NHS dentistry and dentistry full stop actually. So I'm learning to work sideways, so I've started taking up a different role as a trustee of the Benevolent Fund, and I work in a food bank, and I work with DentAid, and I've started to learn to move sideways a little bit, so that if I'm not doing clinical dentistry, I'm still doing things which I find rewarding and enjoyable, even if they don't really pay.
Is Parkinson's something that you think the dental profession needs to be more aware of? And is there anything that you think they could do to kind of ensure that if any colleagues do have Parkinson's, or any patients, how would you like them to be educated so that they can support them? Okay.
That's a really good question. Thank you for asking it. So first of all, let's talk about colleagues that might have Parkinson's. And there are, I'm sure, absolutely sure, there must be more dentists out there who have Parkinson's at the moment, or will be diagnosed with it in the future, because it is a very prevalent condition and it's on the increase. I think 1 in 37 people will be diagnosed with it during their lifetimes in the UK. That's a lot. So I mean, there will be dentists out there, and it's important, I think, for colleagues who have conditions like Parkinson's to understand that it's not the end of the world. It does feel like it at the beginning. It does feel like you do lose your confidence at the beginning completely, but don't. It doesn't automatically go from 100 to 0. It gradually declines, and that happens with people anyway. Parkinson's is just, for me, I feel like it's just a slightly accelerated aging. So just maybe tailor your work and your day so that I try and keep bigger cases dentally to earlier in the day, so crown preps and things like that I'll do earlier in the day when I'm feeling better in myself, and I'll do more checkups towards the end of the day. So things like that. And also I always have colleagues on hand as well, so that I can always check with them if there's something, like if there's the only thing I sometimes don't like to do anymore is suturing. So, if I feel like there's a oral surgery case which will need suturing, I'll refer it to a colleague rather than do it myself. So I think the important thing is to know your limitations, work within them, and keep working where you can. And don't be scared of don't be scared of a diagnosis like Parkinson's. It happens, and it's going to be happening more and more frequently, and dentists will be affected. And colleagues, I think the best things colleagues can do is not look at you like you're now some sort of alien, which my colleagues haven't, fortunately, just be really supportive, and just carry on treating you like the person that you still are. So I think, my colleagues have been fantastic where I am, so I'm really, really lucky. And as patients, there's a heck of a lot we can do. So there's the perceived difficulty a patient has in coming to see the dentist, which is that they might have phobia, which most of the population has anyway. But apart from that, they might worry about things like if they have a tremor or access, and how that will affect their treatment. So patients need to be encouraged to come. Facilities need to be made available, obviously ground floor surgeries, etc. All of that is already in place. But the other thing that needs to be put in place for patients with Parkinson's is the preventative programs, because at my age, if someone's diagnosed at my age, they're going to have very few problems, hopefully anyway. But they need to implement things. So if you're going to have reducing manual dexterity, which one does have with Parkinson's, you need to be using an electric toothbrush from a younger age. As soon as you need to be implementing high fluoride toothpaste. You need to be implementing interdental cleaning with a water flosser rather than floss or TP brushes, because manual dexterity even if it's good, like someone at my age, it's still good. But as the day wears on, and often by the end of the day one is tired, then it's just easier to use these, mechanical devices rather than having to do it oneself. So with Parkinson's patients, I would definitely recommend dentists go heavy on the preventative advice and seeing them perhaps more regularly, perhaps every 3 months rather than every 6 months. And if we can catch problems earlier on with patients, so in their disease progression, and address them earlier on, it's far better than waiting for later on, which is when a lot of patients do end up getting seen instead, actually, when they end up in nursing homes and the carers then call us, and that's what we need to overcome. We need to encourage patients to come, we need to encourage them to carry out a good preventative regime and do treatment when the disease is in its early stages, so that the dentition is stable going on into the later stages, and also be aware of the problems that can occur. Like, for example, TMJ dysfunction can be quite a big problem, because a lot of patients will brux, grind their teeth, and then there'll be others that will have xerostomia, dry mouth, because of the medication that they might be taking, like anticholinergics, and others will be drooling, so you get angular colitis. So I think a general knowledge of the conditions that can occur with Parkinson's disease would be really good, and working, like I said, on that preventative regime is really important.
Yeah, exactly. And I do think there's still a bit of a way to go then, isn't there? I think hopefully this article itself is a good starting point for, educating the dental profession and what they can do to support colleagues and patients with Parkinson's. Well, it sounds like you have a lot of support around you, which is brilliant. Is there anything you wanted to add?
And just that chronic illnesses and chronic conditions are going to be on the increase, and we all need to be there to support each other as a profession, and not be scared of these things. Don't delay going for diagnosis if you're worried about something. There's nothing worse than not knowing. So to colleagues out there who are concerned about things, go get yourself looked at, get a diagnosis. And to colleagues who have friends who are going through something, encourage them and support them. And to colleagues who have patients with conditions like that, don't be scared of Parkinson's, don't be scared of other chronic conditions. There's ways of treating them, ways of working around it, and you're right, there is a lot more to do with regards to patient and dentist education, and I hope we'll move further in that field as time progresses.
I was just saying thank you very much for taking the time to talk to me today. It was great talking to you, and hopefully this article can help to educate some more people about Parkinson's and how to support people.
Brilliant, I hope so.